Hello everybody. Today's video is about the classification of fracture. So a fracture is basically a break in the structural continuity of the bone, and there are different types of fracture. But first, we'll classify them on the basis of etiology. So on the basis of etiology, a fracture can be classified into three types. We have the traumatic fracture, pathological fracture, and stress fracture. In the traumatic fracture, a fracture is due to trauma. Trauma such as road traffic accidents or heavy fall, or when you engage in some kind of fight, then you can have traumatic fracture. In the pathological fracture, the fracture is mainly due to some underlying disease, okay? So the diseases such as osteoporosis or Paget's disease or metastasis of the bone. So these diseases will weaken the bone and they will cause an easy fracture. So this fracture may require very little or no force at all to break the bone. And often these fractures, they go into non-union, which means the fracture site will fail to unite even after 6 months of treatment. The next one is stress fracture. Stress fracture is due to chronic repetitive injury that will cause the break in the bone trabeculi. And often these fractures present only as pain and they may not be visible in X-ray. The next one is classifying fractures on the basis of displacements. Undisplaced fractures means there is no sign of displacements, means the fracture pieces, they are not deviated from their normal position. Whereas in the displaced fractures, there is displacement, okay? So the fracture pieces, they are not in their normal position. So the fractures can be in the form of shifting. So you can see the distal fragment piece has shifted slightly to the right in the form of angulation or in the form of rotation. And there are few factors that are responsible for the displacement of the fractures. And one of them is the fracturing force. If the fracture is due to some heavy external force, then that force alone will cause the displacement of the bone. Another one is muscle pulling the broken bones. You know that the bones, they are attached to the muscle. So when there is fracture, the muscles contract and they will pull that bones, causing displacement. The next one is the gravity. Next one is classifying fractures on the basis of relationship with the external environment. So the closed fracture means the bones, they are not exposed to the external environment, or you can say there is no communication between the external environment and the bone, and it's due to intact skin and soft tissue. Okay, so there is a fracture, but we cannot see that fracture because it's covered by skin and the soft tissues which are intact. But in case of open fracture, we can see the bone. Okay, so there is break in the overlying skin and the soft tissues, and so the bone will communicate with the external environment, hence we can see the bones from outside. And the open fracture can be of two types: internally open and externally open. Okay, so the internally open, the sharp part of fractured bone pierces the skin from the inside. Okay, so let's say if this is a fracture right here, then you can see this pointed sharp part of the bone. So this fractured edge will pierce the skin from the inside and the bone will get exposed to the external environment. So this is in case of internal open fracture. In case of external open fracture, the external force will cause the laceration of the skin and it will expose the underlying bone. The next one is classifying fractures on the basis of complexity of the treatment. Okay, so if the fractures are easy to treat, then they are known as simple fractures. Usually they occur in two pieces, like in case of transverse fracture of the humerus. If the fractures are difficult to treat, then they are known as complex fractures, and they occur in multiple pieces, like in case of comminuted fracture of the tibia. Next one is classifying fractures on the basis of quantum of force causing fracture. If the force causing the fracture is in high velocity, then it will cause severe trauma. So there will be injury to the soft tissues, and often these fractures are unstable and very slow to heal. The next one is the low velocity injury. So there is mild force trauma, and these type of fractures they heal faster. The last one is classifying fractures on the basis of pattern. The first one is the transverse fracture. So in the transverse fracture, as you can see here, the fracture line is transverse to the plane of to the axis of the long bone. Okay, so if this is the axis of the long bone, then the fracture line is perpendicular to it, and this is known as transverse fracture. In the oblique fracture, the fracture line lies oblique to the axis of the bone. In the spiral fracture, there are different planes of the fracture line. Okay, so this is the spiral fracture. In the comminuted fracture, due to some crush injuries or due to some compression to the bones, then the bone will break down into multiple pieces, and that's known as comminuted fracture. In case of segmental fractures, there are two fractures at different levels. So you can see there are two transverse fractures, one in up and one in the down. So it's known as segmental fractures. So these are all the classification of the fractures. Thank you.